This is Willpower.
Oh, it is a beautiful day here, a beautiful day in Austin, Texas. And on the airwaves, I'm so lucky to have Micah Lowe from Simply O3 to talk more about the Ozone game. It's so nice to have you here.
Yeah, thanks. I appreciate it. Excited to talk about Ozone.
Yeah, absolutely. I was just mentioning to you off camera that this is the first time a lot of our audience has heard about ozone and the use of ozone, or maybe they're like hearing it on the airwaves and hearing it and seeing it at shows, but they haven't gotten quite super familiar with it. And so I want to just pop in by saying, like, what are the most powerful wins from bringing ozone into your life? And just really like maybe giving 2 or 3 of the most powerful wins, and then that people can learn from.
Yeah, obviously, like with a lot of things, it depends. But I would say if we're kind of just taking a global perspective on ozone therapy and some of the advantages it can bring into somebody's life, I would say, number one, it's super diverse in its application. So you can use it for a really broad spectrum of different use cases, such as ear infections to gut infections and stomach infections. Systemic infections, immune modulation. And so like when you get a kit for ozone therapy, you kind of introduce into your home this thing that can work for a wide variety of things. So if you have a home apothecary or setup, it's a really good tool. So we actually have a decent following of people that are preppers, right? People that are preparing for doomsday, so to speak. And they like it is because it can be used for so many different things. So you have this one unit and setup that can be used for a wide variety of things. So that is what I would say would be number one. Number two, though, getting more into benefits. So this wasn't a super credible study. I do have to preface with that. But I do see consistent streams of this throughout my course of working with ozone therapy for the last 12-ish years. But Dr. Frank Schallenberger talks about this, and Dr. David Minkoff, where they did a study on users, I think this was within their own patient base, that were consistently using ozone therapy versus not using ozone therapy, and all-cause mortality went significantly down. So people were much more likely to survive highly stressful events, whether that be a cancer or a traumatic event, if they had been undergoing ozone therapy. And part of so not a super credible study, but it's kind of giving us an image of what it's doing in the body, is it's helping with immune modulation. So your immune system is more balanced out, helps with oxygen efficiency, mitigates chronic oxidative stress, which is really interesting, kind of counterintuitive. You're using oxidant and trying to get rid of oxidative stress. But there is a lot of literature and publications on how it does that exactly. So these are really fundamental things to the body. And so if you were to introduce it into your life, I think it can work across a wide variety of things. It has different mechanisms of action based on where you apply it. And it's not a silver bullet, by the way, so it's not going to work for everything, of course, but it does have a pretty wide array. And then it is just really good at the things that it does, such as mitigating chronic oxidative stress, immune modulation, microcirculation, and oxygen efficiency. So I think it's just a really good overall health booster for people that are looking for that edge.
Yeah, absolutely. And I wonder, and this is a thing too, to just mention about all research, which is, it's really interesting. The more that I read research in my life, because I do read a decent amount of, and you guys are so good about sending out education materials and how to, and what the use cases are and how to set the settings for every single use case. You're so good at that. So I'm so appreciative, because I would be lost in the sauce if I had to try to figure it out on my own. But just, yeah, with the research piece, I've had a lot of conversation lately just about, we always looking who's funding the study and looking how the studies are done and where there are gaps. So there's just always, in many cases, there are gaps, and we get such good information. And then it's important for us to then also say, what is anecdotal in the world, and what are we seeing out there, and what are the places that the research might have been able to be improved, but it wasn't funded appropriately, or just there wasn't enough money to do it in the way that it would make it a larger landscape for a bigger win. And just more and more, the more research I read, the more I'm like, this is great. And what else am I seeing out there? What else am I hearing in the world? What are your chat boards? What are people talking about from benefits and wins? And the one quick spin-off question I have is, has there anything ever sort of come out, conversations or even just anecdotal, where people are talking about like mental emotional support in that way? Like I know, and we need to kind of get into what the whole ozone cascade is, but I want to, maybe we put a pin in that and like really talk about, as people are shifting their health, they potentially are feeling better, or if there are other ways to support mental emotional landscape with this tool. Because I think that that's something that comes up quite often, people asking like how it can help with their general overall feeling, right? And that's different than just bodily sensation, but their emotional state. So if there's anything you want to shout out there before we dive into what is ozone and how do we do it?
Yeah, and a few things I guess to be said there is, I'm tied into academia through my work at Theriome, so we actually do publications and all sorts of stuff. So usually when I'm speaking on ozone therapy, just for frame of reference, I'm drawing from a compilation of information. Most of it comes from literature, and so just my reading through the literature and the understanding of it. The secondary tier, I would say, is more the clinical piece, where it is through interviewing of doctors and having talked with thousands of doctors over the years, because this has a huge following behind it. So, I mean, ozone therapy isn't like this, nobody's using it. There's like over 10,000 doctors in the United States alone that are using this on a regular basis, and you have like an upper echelon of those doctors that are really particular about how they're tracking, monitoring for outcome and different things. And so those doctors I generally keep a good eye out for, and getting a good idea of just what their experience is with ozone therapy. So that'd be second tier. Third tier would be anecdotes. And then I try to look at, because I've heard, at this point, thousands of stories, people's experience with it. But what I try to do is just assimilate those into categorical changes, like how is it affecting people in mind? How is it affecting people in this? And just kind of the overall sentiment. So those are the three primary areas I pull my understanding of ozone therapy from. But getting into your question about just how it affects the emotional state. So I don't have a great answer for just like, if somebody has depression and anxiety, what is the effect on that in and of itself? However, I would say with physicians that are utilizing it, and say somebody is in a disease-associated state, so they're not doing very well and you're sick. And usually when you get a diagnosis like that, or it's a little bit newer, or it's just heavy emotionally, there's a lot that comes with that, right? Because it really retunes your identity, how you perceive yourself, how you perceive the world. And that can be a really emotional thing. So one thing I would say though, is a lot of physicians like to use it because it's kind of a quick win to energy. For many people, not for everybody, but for many people it is. And so when patients see that, they feel encouraged. So I know that's more on the encouragement side and going through things. I couldn't say exactly how it's acting on, anxiety, depression. There is this doctor, Jeff Baker. I think he's in Idaho. He was talking about, he uses ozone therapy in those cases, but I think he actually really likes vitamin B12 shots, if I am remembering correctly. So for an ozone therapy physician who also works with a lot of anxiety and depression, it's not his go-to, although it might have some effects there for people. I think it's more indirect, and it probably would depend on the cause of action, like what's going on in the body physiologically that can shift us into a state of where we just don't feel right. There's a reason why we don't feel good when we're not active, not moving, not exercising, right? And those are physiological things. And then you go out for a run and you're like, oh, I really needed that. It's because your body has a physiological response that it's responding with and giving you the type of food and stimulus that your body needs to put you in the appropriate mind space. So even with that physician though, it's more, I don't know if it's secondary, but it's not something that he's looking to as an anxiety, depression treatment.
Yeah, and you mentioned earlier on just like this better oxygen uptake. It's not the exact words you use, but if we're oxygenating the system more, I would tend to believe that is going to be delivery to our muscles, our tissue, our brain in a way that feels like we could potentially feel better or have better focus or become more aware of things in our surrounding. And that, to me, is always going to speak to feeling a bit better versus feeling muzzy-headed.
Well, I will say, like, literature does comment on, and this is pretty consistent, but overwhelming feeling of wellness, which is kind of an interesting way to put it. But basically, you feel really, really good. So there is a sect of people that when they do ozone therapy, they feel really, really good. We don't understand exactly why that it is. It could be the microcirculation. It could be the increased oxygen efficiency, which we can kind of get into what that is and why it's important. But yeah, so, I don't think those were necessarily targeted at things that are associated with a negative mind space, like anxiety and depression. But there are a good portion of people who experience like, oh, wow, I just feel really, really good, right?
Yeah.
That's like after a workout feeling sometimes, except in a more sustained sense.
Yeah, no, this is what I was just mentioning. I'm like, I need to press record before I tell you all the accolades. But when I was mentioning to you, but right before we started recording, that one of the first times I used the Ozone machine and the Simply O3 machine, the home unit, in several occasions or on several occasions for various different things, which we'll go into. But the first time that I did major autohemotherapy was with a team of clinicians at a show, one of the trade shows that we go to, and I'm not very good with needles, so I was like, I need to be laid down. I feel all dizzy. I feel all crazy, and I was nervous, but also excited to try it, and just my fear of needles made me have a moment, which was so nice because the staff and the nurses were like, "You're fine. Let's just lay you down." But for like at least a week after, and that day specifically, I was like, wow, this is rivals what I felt like when I was getting like an NAD infusion. Like it just really made me feel energized, clearer. Like there was just this notion of like, oh, I have a little superhero vibe going on. And so even with the stress of the body and me having I need to lie down and all those things, which sometimes can kind of take a toll on you, I felt so good. And I've seen that sort of response in people as well. So just to share my particular experience with it all, yeah, that's how it felt for me.
Yeah, most people don't pass out, but you
I
get
don't
to
know
be
what
in the.
passes out, but it's like a needle thing with me. Most
Yeah.
and everything we're doing at home, I'm certainly not doing any of that at home with like
Right.
needle or blood exchange. Right, I don't have the skill or the letters behind my name, but this is why the home unit is so amazing. We can talk about all the wins there, but let's talk about a bit about how you got to this, because I think this is an important part of the story. It's feels like it's been a bit of like an uphill research. Let me gather my information. Let me continue to You're one of the foremost educators in this segment in the world. Like, how did you get to this place that you got passionate about this? You had an understanding of this, and I know it ties back into your family, and I'd love you to share.
Yeah. So I guess at this point, I would probably be considered a key opinion leader within the ozone therapy space. And I'm not just like trying to say that to make myself sound better, but I think considering the audience that I have of people that are paying attention to the work that we do and what we put out and the information we provide. But here's the thing, though, is I'm not creating the source material, right? I'm not putting together the studies. I'm not I don't have a clinic. I'm not even a medical doctor. So I view myself more as a journalist on behalf of Ozone. So what I'm trying to do, and in conversations like this, is really just give people the state of the art on this intervention. So this is one intervention. It's pretty cool. I just want to deliver the information that exists out there in a very digestible way. And then if people want to understand the biochemistry and stuff and get more in depth with it, they can go and research it. I'm not the one creating that. So what I'm doing is I'm just kind of amalgamating all the different perspectives on ozone therapy, giving my opinion and putting that in front of people. But the reason that I got to more of this space was a long time ago, but essentially my brother had cancer and he was going through Johns Hopkins, great medical system, and I've predetermined I'm not going to do chemo and radiation and all that kind of stuff if I ever got cancer. Either I'll just die without it, or I'll find a way to live through it. Like I'm good with that. But so there's all these different perspectives on kind of that conventional model. And so for my brother Matt, he decided to go down the conventional system and do everything that the guy in the white coat told him to do. And I wish he would have taken a little bit more charge of his own health and tried to sort that out for himself, rather than just trusting that these people, which is a really silly assumption, that these people know everything there is to know about medicine. That's such a ridiculous, and nobody would say that outright, but that is how people act. Mm-hmm. If the doctor doesn't know it, or the doctor doesn't recommend it, it might not be worth doing, or they really know what's best. It's like, they are trained and they really do have a good comprehensive understanding, but they are still limited by having a human mind. And furthermore, it's your body. So you're going to invest so much more into it and have so much more intentionality and intimacy with what's going on than any doctor is going to have. And I'm not saying that they're always going to be wrong. I'm just saying, like, you need to put yourself in the captain's seat and view the doctor as the advisor on your health status. So anyway, my brother Matt had cancer, lost a lot of his critical thinking processes, had multiple open brain surgeries, started to really change his personality and different things. And at the time, the thought process, there was this guy at church that recommended, maybe hyperbaric oxygen would be helpful for Matt. And that was kind of like the Alice in Wonderland going down the rabbit hole, right? Because at the time, I wanted to become a physician myself. I was a bit younger, and so I was going to go through that model. But it turns out that hyperbaric oxygen was really, really helpful for Matt. So all his quality of life metrics drastically improved. His sleep, his critical thinking, his energy levels, feeling of wellness, just all these things, significant improvement. So you go and tell the doctors about this new exciting thing, and they're just kind of like, oh, that's really cute. You're probably getting a placebo. So we're going to keep doing the things that we know that work. And if that makes you feel better, go for it. And that was kind of the sentiment. And then, the response to that, though, in my mind was like, okay, so we have this thing that's massively helpful for Matt. The doctors are not super interested in it. So maybe there's other things they're not interested in that could be really helpful for Matt. And so, staying in the strain of oxidative therapies, hyperbaric being an oxidative therapy, found ozone therapy. So and that was another therapy that we applied to Matt, and it was really helpful to him. But one thing I noticed and kind of saw a little bit of an opportunity with is as I was going through and reading kind of little literature on it and trying to understand what's going on with ozone therapy, like what is this potentially going to do? Is this going to be a benefit to him? Is it like a risk? Is it like going to cause more damage than good? Like trying to sort out all those things. I just started to kind of write and catalog and turn into articles, kind of the what I was seeing through the literature. Because at the time with ozone therapy, there was a lot of different medical studies. I think at the time there was over 1,500, 1,800, and they range in credibility. Some are double blind, some are just like doctor making observations, but there is this really consistent theme among all of them. And so I just started to take those and condense those into easy to digest information because nobody had done that. So that's why I'm reading through all this literature, is because there's no place I can go to see like what Kristin thinks about ozone therapy and how she came to that conclusion. So I just started to do that, and then that circulated, among clinics and that type of thing, where they would, give it to patients or just educate themselves a little bit on it. And then the next logical question from there is like, where do we get equipment? And so that's kind of how I got started with this, was out of a desire to help my brother. Then seeing like, I'm going to be reading this anyway. I could just be documenting what I'm learning. And then that turned into having a business. My brother did pass away in 2018, but he lived approximately 16 years beyond prognosis. So did have a lot of time with him that, I can't say that it was just due to ozone therapy or anything like that, because there was a lot of things happening, but we did have a lot of time with him, thankfully, that wasn't
It's beautiful too that you were like, all of this was spurred on because you cared about him, and you were like, let's get some research in this, and how can people be changed in ways that even like medicine, modern traditional medicine doesn't understand in some ways, although ozone of course is understandable. But I spoke yesterday with Leslie Kenny, who's overseas, who you probably know, and we talked a lot about this advocating for herself, that people were like, you have lupus, you have all these other things going on, and she was like, I just kept showing up to like doctors with some knowledge, but like I had to keep advocating. I had to keep, she said, swiping left on that doctor, finding another one, finding another one, finding another one. And I think that that's one of the critical points that you make. And just, I also want to honor that a lot of this was done, really from your heart, because you're like, how can I have more time with my brother? And that's just super beautiful, a beautiful piece of this whole puzzle, I think, in the story.
Well, yeah, and I have a strong relative, I really strongly relate to a lot of people that I communicated with. I'm not like answering phone calls or anything at this point, but I did that for a very long time. And so I think that's what helped to kind of progress the word about ozone therapy, is because like I really do care about people getting a good result, and I can really relate to where they're at. They're just trying to figure things out. So yeah, I'm really thankful for the experience. Obviously, nobody wants to go through that pain, but you have the opportunity to make the best of these different trauma. You know, don't let a good tragedy go to waste, because those are great opportunities to grow and to build and to do something good.
Yeah, yeah. And do you think, I want to unpack two things. Number one, I want to, because I think there's some people that listen to that may be listening being like, ozone, like it's in the sky as a layer. And yesterday I was in a photo shoot and they're like, we need to make some steam. Here's some canned ozone. And I was like, it can't be canned ozone and we're all breathing it, because that wouldn't work very well. And just, I want to give a little understanding of sort of actually what ozone is, and like where you're seeing the applications rise first, right? Like to me, where I've most heard about it spoken about in the earlier days is around like autoimmune and Lyme and cancer and things like that. And of course, we're not here to talk about it being a cure-all, but like I saw it sort of in the chronic illness space first. And so could you give us sort of the little mini one-on-one primer on like what ozone is, so that people who are feeling like, because there are contraindications and there are ways not to use it, but people are feeling like, I don't understand it, or is it dangerous? And then really talking about where applications first were born.
Yeah, absolutely. So it is a therapeutic gas. You know, like hyperbaric oxygen is using oxygen. One thing you can't do with ozone is you can't breathe it. So that is the one limitation with it. But there's a lot of misnomers about ozone, and largely that's due to pollution. When there's pollutants, we get that smog, which has in that mixture ozone. And so there's a lot of publications on ozone's negative effect on the lungs. And nobody argues that. There's nobody that does ozone therapy in their clinic that says, like, I want you to breathe this stuff. You know, so that's one thing that you can't do with it and can't apply with it, is you can't breathe it. And you can smell it, like small amounts are fine and that kind of stuff. You just don't want to be in an enclosed space for long periods of time with ozone running. And the reason that you can't breathe it in, but you can use it in other parts of the body, is because there is no antioxidant defense system in the lungs for something this strong. So when you breathe it in, it just interacts directly with the lung tissue, causing oxidation and stress and those types of things. So people get like coughing and that type of thing. But in other parts of your body, say the blood, there is a very robust antioxidant defense system. So what happens is when you push ozone gas into blood, and so they take a little bit of blood out, they put in some ozone gas, is that it interacts with the antioxidants, and that creates the mild acute oxidative stress, which then when you put it back into your body, it is a small stress, but then your body responds to that and goes, oh, there's a bunch of stuff that we need to fix. So it responds by increasing antioxidant enzymes. It responds by increasing aerobic capacity, pushing up that anaerobic threshold. The immune system gets some function out of it, so it modulates and balances out the immune system. But
is that just happening with mixed with blood, or is that also when it's just gas going through the tissues and the various ways we could insufflate it, et cetera?
Yeah, so there's essentially two different ways that you can apply it to the body. One is local and one is systemic. Systemic means that it's going to benefit the entire body in some way, more like the body as a system. Local means like we're delivering it to a localized area. So an example of that would be like if there's an infection on your skin, say like MRSA, you can put like a little bag over that area, and then you can push ozone gas into that bag. And what that's going to do is that's going to dismantle the infection that's going on. It's going to stimulate the natural immune response in the skin by creating, your body actually naturally makes ozone. So it helps to stimulate more ozone production, more hydrogen peroxide production, which your body also naturally makes. And then it stimulates growth factors for that to be able to heal up. So that would be like a localized treatment where it's like it's treating that infection, but it's not like seeping through the skin, you know, in a really large way or significant way and affecting the whole body. So within the systemic forms of ozone therapy, there's 3 different ways to do that essentially. And it's intravenous ozone therapy. So you go to a clinic and they do IV ozone therapy. There's rectal ozone therapy, not super glamorous, but it does work really well. So the reason a lot of people go for that is because going into a clinic, 2 to 3 times a week is not super realistic. Because you want to get like 12 to 20 treatments, and that is like the gold standard. That is the best way to do it. So if you're really sick, and your doctor thinks that that's a good protocol for you, then go for it. But you can either supplement that, or you can get a lot of that effect through the rectal insufflation. So that's like an ozone gas enema. You take a small amount of ozone gas and put it where the sun don't shine. You hold it for 30 seconds, and you're all done. So it only takes a few minutes too. And then there's vaginal insufflation. So vaginal insufflation is another really good way to get a systemic treatment. It's also good for if there's UTIs and things going on there that it can support.
Yeah, yeah. And those, I've done both of those. And those are what's amazing is you're like, oh, I'm done. That was my treatment. I'm done. It's like under 2 minutes for me to like lay down, do the thing. I've definitely done it post coffee enema, which is a whole nother process, but then you're sort of like giving yourself the double whammy, as it were. But that's, for me, it's all about like this ease of use. I've certainly seen, colleagues and friends of mine doing like a little bit of also this like, doctors, clinicians, whatever, like injections into joints and things coming off of your machines so that it's like really working targeted to specific areas, whether they're bagging it or adding it to the mix. So that's so cool. Yeah. And then, so it's safe, fun, and effective. Also, not to be totally messed with, because when you want to be on top of it, focused, and have the time to really be able to set yourself up to do a treatment. If you're going to be using the home treatment, if you're not going to a clinic and using it, having someone work with you. And when it comes to sort of, I want to say the low hanging fruit, but like, who are the people who make the most sense, or who started sort of this cascade alongside you saying, hey, this is where I'm really needing this? And in my mind, it's always sort of been like this chronic illness segment, but are there specific conditions that have used this more often, or just helped with the uprising of conversation around ozone therapy?
Yeah, so when I first got into this, it was almost exclusively chronic disease. So the top 5 were and still are more or less, but cancer, Lyme, autoimmune, infectious disease, and mold toxicity. Those were the top 5 use cases. And I'm not saying that's where it's like the most effective. Like if we're just saying like based on significance of ozone therapy in an application, I would say like peripheral vascular disease, the topical wounds, wound care. I think that is where it's like, okay, this is undeniably like better than conventional standards, is based on like peer review, like double-blind placebo research and all that kind of stuff. So like those have high significance to those indications. But with cancer, Lyme, autoimmune, infectious disease, and mold toxicity, that's like what is clinically used the most often in the chronic disease case. Then over the years, it's been interesting, and I'm sure you've been on this side too, but just to watch this industry evolve over the course of over a decade now, because, biohacking was a thing, but it was really small. It was super niche, and now it's becoming like, and I kind of keep on thinking it's going to like die out, and then it's not going to be cool anymore. And then it gets like
names like health optimization or whatever, but it's all that sphere, right?
Well, and then it gets a new, reinvented a little bit, or a new face comes to it that lends it a lot of credibility. And so like, I really do see it continuing to grow and get bigger and bigger, as a thought process, right? Because it is a school of thought. But yeah, so with that transition of the industry, and there's been more transitions than that, especially during COVID, like the industry changed significantly. I don't think a lot of people saw that, but on my side, like I was seeing like all these clinics, these integrative physicians that were really kind of the bread and butter of the industry, where they go outside of their network, they go to cash pay, they take these huge risks going outside of scope of practice. And a lot of those doctors are just top notch, because these are the people that really started and gave the foundation to this industry. And these were the people that were going out and doing the research themselves, getting a good understanding of what's going on, how these different therapeutics are affecting the body. When we had COVID happen, what we saw a lot of is like, we were already kind of on the edge of burnout with like some of the conventional system, but then like floodgates just really started to open up, where like nurse practitioners, physicians are just tired of the system and the way that things are done. Having a 6-minute patient consult is obviously not adequate to motivate somebody to change their health trajectory, and you just don't get enough time. And so it's like these incentive models, just obviously there's a lot of faults with them, with how the conventional system is done. So we've really seen this transition now into more like biohacking. And since, COVID too, a lot of professional athletics, I'm not sure how many teams have actually used our equipment at this point, but it's a significant amount across like baseball and soccer and basketball and football, of professional teams have used IV ozone therapy as a performance enhancement. And the reason I say is I'm not sure on like all the different teams and people that have used it is because sometimes I'll hear of like 3 players that are using it. I don't know if it's just those guys, the whole team. I know it's not by the actual team itself. They never endorse that type of treatment. And the players they don't want the team to actually know about their health status or the treatments and interventions they're doing. So they try to keep that separated.
Or sometimes they're just like, I'm not going to tell you about my magic pill that I'm doing. Like I see this even as simply with like I go in and I work with an athlete with breath and they're like, I don't want to talk about this. And I'm like, but we're doing great things and all the scores are exactly where they want to be or you're winning or whatever. And I'm like, I want to because I'm like advocating for it. And I'm like, we're having success. I want to share it. And they're like, I'm not telling anyone. It's my secret pill or whatever, So it's finding the things that win for them. And perhaps that's that, or perhaps they just don't want to share their health. Like they want to be like under the radar if they have something going on or.
Well, part of it is like, so the professional sports teams, it's always used against them. Any of their health data that they can get a hold of is never used as a positive. It's always a negotiating point for a risk factor. So it's basically just rule of thumb is give your team or your franchise as little of health information as possible, because the more you give, the more fuel they have for negotiating a lower price based on like risk factors or different things. So like, genetic data to their team would be like a nightmare, right? Yeah. Because like now they're gonna have all this like basically they get loss of income. There's reasons for it, but and obviously players are going to be different. So some are going to be advertising and just don't care, and just doing things and just saying it's performance enhancement. But yeah, we've seen a huge uptick in like professional athletes and that type of thing. Very significant amounts of these teams have used our equipment. And yeah, so we've kind of seen this transition to a degree to where it used to be almost exclusively chronic disease, and now it's kind of not an even split between biohackers and pro athletes and triathletes and all that kind of stuff, but they're probably 30 to 40% of the people that are getting into it now.
Yeah, and one of the beautiful things I always say, the silver lining, I don't know, it's like, I don't think there was anyone that liked COVID, but it's like, and the silver linings that whole COVID fandango was really, I think, just the awareness of the general population. The general human was like, oh, wait a second, I need to really actually think about my health. I actually have to think about what I think about my health. I have to think about actually like what I'm intaking and what is going to affect me and how other people's health, emotion, well-being, contact is going to affect my health. And while I didn't ever really want to deal with that whole era of our lives, I also felt like I could see people, when gyms are closed down and they would like go out to the parks where the Parks and Recreation had spent tons of money putting these weird gym things in parks that no one ever used before then. And I'd be like, oh, someone's on the pillow bar, someone's on this like bench pressy thing, someone's like walking on the balance beam that never got used except for maybe by the kids locally before. And so I really like that there's this more, a larger understanding anyway of people wanting to maybe advocate for themselves or at least think for themselves in this way, which is, one of the sort of tenets of biohacking, I think, is autonomy. And also so many more people were doing that and have been doing that since COVID. So I think that there's a more awareness, just if you're speaking about the general householder versus even like pro athletes and teams and all of that, and the chronic illness family that exists in the world, many of whom I've either interviewed or been in contact with, so many people navigate these things. They're always going to be like on the soapbox because every day they're navigating those pieces of the puzzle. But to get the average person more in line with how they can boost their overall health before issues happen or perhaps prevent some things from happening, I think that's the win. I think that's part of the big win, either not just from COVID, but also the advancement of all this ozone therapy over time.
Yeah. I mean, yeah, you have to develop an opinion because I should have an opinion on this because I might be forced into something I don't want to do, but I don't even know if I want to do it or not. Like I'm trying to figure this out, but now there's all this propaganda and stuff and it's like, it's confusing. So yeah, it does kind of force you to think about it philosophically and also just try to get to the root of just how you perceive these different institutions and what's going on there and how they function, the reason that they do the things that they do. And so, yeah, it's definitely created a big mindset shift in that way, I think, for the positive. Although, yeah, it was not a fun time.
Yeah. And you just shout out at one or two things that you think you hear as pushback often around ozone. Like, I just want to, there might be people listening that are like, oh, I don't really kind of get it. Or like, is it really going to work for me? Which is always obviously a use case scenario. But just like, are there a couple things that you either hear that you can easily debunk or that you're like pushbacks, contraindications, people are like, ugh, ozone, I don't buy it. You know, I don't think it's a real thing. Or do you still even hear that or?
Yeah, of course. So real quick, because I forgot to mention on the athletics, so like why are athletes doing it? And there's this website, Metaskill, mediskill.com, that has all this information. But for example, this is 2 different studies, independent of each other, 2 different countries, but similar groups. They both looked at semi-pro athletes. And essentially, if they're doing ozone therapy in the same training regimen, they have a 20% boost in VO2 max over the control group. So you get like, and that's the oxygen efficiency thing at work. But anyway, as far as going into people that are naysayers.
Yeah, but that's a big deal. I'm glad that you brought that up, as it is a big deal. And it's like, semi-pro might be in the specific literature, but also this is going to mean that anyone, whether it's a triathlete, a householder, someone who's playing pickleball regularly who wants a boost, because that VO2 max thing from a training perspective, it can be a hard needle to move. So it's
associated with longevity. I mean, it's one of the best metrics that you can push up. Like you want so I've been for a very long time, a very anaerobically driven athlete. So like jumping and sprinting and heavy explosive weight movements. I used to be a competitive weightlifter. I'm a lot smaller now, by the way, but anyway, so like, but you know, I know VO2 max is really important. So now I'm changed my training dramatically to where I'm really focused on zone 2 cardio and improving my VO2 max through that way, because it's really important for the longevity and the health span of your life. So you definitely want to be checking that box. Am I doing the appropriate amount of zone 2? Am I doing the things to improve my VO2 max? And then, you know, if you're into therapies like this, ozone therapy is a no-brainer to add into that mix. But going into the naysayers, though, I mean, there's a ton. You can easily search online. So the FDA has put out a statement that says ozone is a toxic gas with no known medical benefit. It makes sense for them to make that statement because nobody has gotten it FDA approved to date, and they don't want to regulate it. And it's considered a class 3 de novo, which would be hundreds of millions of dollars to get through the FDA process, to go through all the burden of proof. And there's not really any money at the end of that. So the only things that make it through the FDA that are truly novel, because there's different statuses. So there's like 510K status, which is essentially that there's a corollary market device that exists already that you're just really similar to. And so that's easier to get approved. But when you're saying like, hey, we want to do this totally new thing that hasn't made it through the FDA system in the past, then it's like hundreds of millions of dollars. And so what are the things that make it through that process? There are things that make stupid money. And so we've kind of created this system where all we do is perpetuate more drug development because those are the things that make stupid money, because they do symptomatic coverage and people have to take them for a very long period of time. And so ozone therapy is unlikely to get any significant approval. I think at some point it probably will within dentistry, hopefully. But even then, like, you have to be creative, and it's going to drive the costs up so much that it's challenging for people to utilize. So anyway, the FDA has put out this statement about ozone therapy and its stance on it. And so people will read that and they take the FDA at their face value and just go, oh, okay, pseudoscience, great, without actually observing the literature. So you can find a lot of people online that they do a lot of straw man arguments, or they just say the FDA says it's a toxic gas, and they don't actually look at the literature. They don't actually go through it. You know, one thing that I've found that's really interesting is academia and medicine are actually very disconnected from each other. People think that they're in sync, but they're not.
From what I have witnessed, from I've read way less research than you, from all of the things that I've seen along the lines of ozone and its rise over the last 10 years, if we're talking specifically about that time period, is that people are having big wins using it, right? And I hadn't even really spoken to you before this about the application for sports performance, which is also very exciting to me because this is another thing, VO2 max, as we age, longevity, that feels like, why wouldn't we want to put something that's an intervention in our life that is a little bit of a technology with this gas that can then layer in? It's putting W's on the board, whether it's not about just, it's putting W's on the board for your life, for your family. And this is the other thing about having the machine in the house is like, if something comes up, everyone can use it, right? It's like tinnitus is like probably the worst example in the world, but I'm like, I'm going to use Ozone with the stethoscope or the, whatever, what do you call the earpiece?
I don't know, just a headset.
The headset.
It's like,
like
I grew up out in the country and my cat's name was Cat, so I'm not very creative with the with the
But like
name.
I use the earpiece to be like, okay, I'm going to have time to sit and do a little bit following the guidelines that you guys submitted for tonight specifically to try to work on this because tinnitus, again, is like, it's 14 things, right? It's brain tissue waves, it's ears, canal, it's, ENT, it's all of that. But where are the ways that I can utilize this that I'm going to potentially make some gains so that I feel better? And also, P.S., all of these things, even though it's like quick and effective in many ways, like a lot of these things, it's really like sitting down, making a decision that you're going to take some time during your day and focus on your well-being. I would sit for, 5 to 7 minutes. I can't remember exactly what it was to run the Ozone through the earpiece. And I would actually be like, this is nice. I can sit in quiet. I would sit in like the other room where it's like nobody in that room. And I'd have a few moments to myself to sort of downregulate, check in, sit with the device and just feel like I'm treating myself to something that is going to be helpful. And also, sometimes the shit hits the fan and you don't get outside. But the difference my energy, my emotional state would have had by the time I got to bed last night would have been magically different if I had gotten 20 minutes, 10,000 steps, a better workout, etc. And the other thing I want to just like shout out to you and all of like the helpful information that Simply O3 has put out, which is like educating people and just manual description, the things that have come to me from practitioners that you have sent. I don't know if you're sending it through a clinician, but I got this beautiful, like, I don't want to call it a workbook or a brochure that just said, here are all settings and ways you can use this that came separate from the machine. But And I have a machine now in my home and also had been using a machine of a very good friend of mine for the last couple of years, but really understanding that it takes a moment to advocate for yourself. And then it takes some gumption to say, okay, I get this machine and order it and have it come to my home. And then it takes, a little bit of effort, which we have to put in, which we can't play lazy man or woman about, and setting up the machine and getting your oxygen connected and making sure you're having some conversation. Like I had a conversation with my medical practitioner to just keep them in the loop, my health coach, what have you. And all of those steps are along the path to us being able to say, okay, now I grok this information. I understand this at a level that I can speak about. I get lucky enough to have you on the show so that I can really get an even deeper education and share with the audience that these tools can be life-changing. And in many cases, we see them be life-changing. And so I think that's a very strong message just to hear the way that you have stood on this. And I think this leads right beautifully into this question, which is, I know some of the things that have come across your landscape, but like being an entrepreneur in this space and navigating naysayers and all of that, like are there one or two things that have shown up in your entrepreneurial journey as you have like advocated and launched and worked with and put Simply O3 and more Ozone information in the world? Like are there setbacks that you're like, oh, this was a really big setback, and actually it spurred on the biggest amount of growth for awareness for this tool?
My gosh. Yeah. I mean, there's a lot of different ways I could answer that. I really do believe that the biggest enemy to myself, to doing business, has been myself. I've gone through a lot of different phases of life. After my brother died, I was drinking excessively to the point that I would say I was addicted. And I had to overcome that, and just like all sorts of different stuff that I've gone through, and and a lot of shame associated with that. So I would say like my biggest enemy has definitely been myself, and those have been the setbacks that I've put on myself. And those come from various places. They come from trauma, learned behavior through childhood, and different things like that. So I guess I would say number one, because those are the most controllable, right? As those are the things that I can change. Are myself, and that is going to lead to the best outcome once I do overcome those. Something I've been working on, I guess, to tie it a little bit to earth in recent manner is I was talking with somebody and he just asked the question, what do you like in your stress state, your calm state, and some other state? I can't remember what the other state was. And then listed like 4 or 5 things underneath each one. Stress state was like really like brute force, just trying to make things work, driving really, really hard, working myself to the bone, not very present with my family, and just, trying to make things happen through force essentially is kind of the overall theme there. And then because of that, obviously just really stressed out and all that kind of stuff. And then he asked what I'm like in my calm state. And it's like, oh, I'm reading, I'm praying, I'm journaling, I'm working out. I'm like spending a lot of time with family. I'm super present with them. I'm, obviously don't have the stress because you're in a calm state. But then I realized and this is over the last few months, that my game is to be in a calm state. And so what are the dominoes that I need to kick over in order to perpetuate that calm state? And so I would say successfully for like 2 months now, I've been in a very calm state. And so these are all just different examples of things that you have to work through to overcome. And I think those are the most actionable is yourself looking inward. I think secondarily to that are, outward environmental things. And so, there's been different things that have come up. We had some regulatory things that we had to work through where it was like potential overnight shutting down of the business. At that time had, 25 people working with us or so. And so, and then it came at a time that I had promised like these really awesome bonuses, which I was super happy to be giving out. And I made a lot of money too, but, I was like on top of losing, I think it was like 40,000 a week for a while. I was just looking at the end of the barrel, more or less, and just trying to figure out like
feeling the weight of that on your shoulders, right, as a leader.
Yeah, because it's like, I don't want anybody to get cut. I don't want anybody to lose their livelihood. I don't want anybody to, they didn't sign up for that, right? And so it's like, I know we kind of have some shared burden, but ultimately, like, it's on me to figure out how to navigate that. So working through things like that, and I've also had I have dabbled in a lot of different businesses. So like ozone therapy is where, that's kind of my main thing because I'm very knowledgeable on it. But, I span a pretty wide spectrum between like theory I'm working with really advanced lab work and diagnostics and academia to interventional side with ozone therapy to even right now I'm going to go meet with my brother after this, but we're doing this, I don't recommend people doing this, by the way, if you're getting into the business, is to get as distracted as easily as I do. But it's also, this is my calm state and this is how I enjoy life. So I get to do it, and I'm not going to make as much money and that's fine. But we're just making a hot tub that doesn't require any chemicals. So you don't have to put in anything that stays purified. I've been doing that personally on my hot tub for 2 years. And so
nice. That feels like a big win for the rest of us.
Yeah, like, chemical sensitivities, you don't have to worry about it, or just the mutagenesis itself from chlorine and bromine and all that kind of stuff. You don't have to worry about it giving you cancer anymore.
And are you weaving ozone into that picture? Because I see ozone, I know it's not your specific. Yeah, it's like I see it in the ice bath world all the time.
Yeah. And so it's like, it gets more complex when you have hot water and the amount of water that we're dealing with. So that's why it's not addressed. But when you look at, and I went to this, like I've been doing it for 2 years. My brother asked me, like, if you had 100K and nothing else going on, what would you do next? It kind of forces you into like a corner of what. So I listed off some things. One of the things with this hot tub idea, and then he got all excited about it. He's like, "I'll do most of the work. I'll do it." Like, you don't have to work much. I'll make sure you don't work much. It was like, and because initially I kept saying no, and then I was like, "All right, let's give it a shot." But I'm assuming
predominantly home use hot tubs, like for people with home use.
Yeah. It's not ozone therapy. It's just a hot tub.
Right? Yeah,
it's just a hot tub, but you don't have chemicals and maintenance. So like those are two big things. Either if you don't like the chemicals, you don't have them, or if you don't like maintenance, you just don't have much. So I think within the next 60 days, we'll be launching because we have working products and all that kind of thing at this point. Yeah.
Where do we see the future of ozone?
I don't know.
Besides hot tubs, which by the way is the most exciting thing.
Yeah, I mean, hot tubs are just kind of like a for fun thing. I like, things that feel like they're a little bit lower threshold, like, I have to make sure that it's like is safe. Nobody's going to get electrocuted and all that kind of stuff. But like, I do get a little bit, it's really challenging working, like with Ethereum is actually where I spend most of my time, but it's like, it's such a high bar. It's really nice to have something that's like, oh, this is just a hot tub. So we just have to make a cool product, and like, there's not much to it. But yeah, so as far as the future of ozone therapy, I think it really depends on the medical landscape. I think that is going to have a much bigger impact on, because this is just captured up in the toe of whatever the market is doing. And so I think the future of medicine is going to be really interesting with the intersection of AI and what's happening there, which we're, I didn't really anticipate it when I got into the diagnostics, but we're basically one of those guys now, which is like AI, and like it's becoming a tech company. And it's like, oh, I didn't want a tech company. I want to help. Like it is going to help people, but I just don't have as much personal interest in that side of things. Like I would much rather have an experience-driven environment and product with people. So hopefully in my 40s, that'll be something I'll do. But anyway, I think ozone therapy, I think there's a chance it'll get FDA approved for something like dental procedures or the oil for some sort of topical application. Hopefully for dental procedures with the machine, because then off-label use would be possible. So when you go through the FDA, you get approval for something, like even they do this with prescriptions, right? Is they'll give Adderall for people who can't sleep well if their thoughts are racing and stuff like that. So there's all sorts of weird ways that doctors will give off-label use of something. So anyway, with equipment, if it got approved for like dentistry, then they could go off-label use for like other applications too. So that would open up the door a lot. And I think that is a good possibility within 10 years.
And I know also you can get the oil on your site, the ozonated oil. And for me, I've used it for like acne, for like cuts, for things like that. I wonder, is there a general use you're seeing, a use case for that that's like the most popular topical application?
So it'd be wound care. So non-healing wounds, infections, MRSA, really anything on the skin that you don't want there. Because
I feel like it works like gangbusters, to be honest. I'm like, oh, I have a pimple over here, and it's like, it's quick and down and dirty. And I always like put a little on before I go to sleep at night.
Oh, it's great. Yeah. I mean, it drops off an oxygen singlet, so it's similar to ozone gas. But yeah, and the next hot thing is ozonated glycerin. So I got into that in January. So you have all the properties of ozonated oil essentially, but now it's water soluble, so it absorbs really well. So like the oil is good for like sustained release. You want it to sit there for a while, but none of these skincare companies were adopting ozonated oil because it smells bad and it has that oily residue. So like, but now with the ozonized glycerin, we just solved like the biggest problem, and it's such a simple thing. And by the way, they've been doing this in Japan for 50 years. We're partnering with the organization over there, and they sell over 1 million bottles a year of this stuff for cosmetics.
Wow.
So it's like a big thing there. They haven't internationalized, so we're their first international relationship. But anyway, there's some good use cases there for.
And that's like overall for clearing skin, brightening the skin. Is it like a fine lines and wrinkles thing? It's like putting more oxygenation in the skin tissue, like facially. Was that why it's such a win?
Yeah, like the oil I think is really good. The glycerin's going to be better just because of the composition of it. But yeah, essentially, so they have some studies. It's like collagen regeneration and promotion and that type of stuff. So you're getting growth factors and whatnot. But it's like anything. Like in isolation, like, and they do have studies on it. It shows like collagen and antioxidants and things, which are going to be good for your face, but I think probably in an amalgamation of things is going to be where it's best suited. So how it's paired with your overall skin routine, not just like, oh, I just use ozone oil. You'll probably get some benefit, but not as much as if you took care of everything that you need to with hyaluronic acid or whatever it is.
Yeah. So cool. I love to see the innovations that are coming out. I always like to wrap with 2 questions. The first one is, outside of the world of ozone and everything you do you have a favorite like biohack?
Yeah, I mean, I was on a podcast recently and she's like, what are the biohacks you do? And I'm like, not much. And then I started to go off and I was like, oh, I do like 30. So I generally think of myself as not doing many, but I really like Katsu, even though I don't use it as often as I should. So that's blood flow moderation. They're the bands that you put on your arms and legs. The reason I like those is because they're, they have some good studies on like sprint training. So people coupling that with sprint training, like more explosive movement because you're activating type 2 muscle. So I think, that's something I always show everybody who is not into biohacking. And it's like such a great, fun novelty tool to have in our repertoire that it's kind of fun. Biohacking, otherwise, I'm trying to think of stuff. I mean, man,
I know, I'm always like, I don't do that much biohacking. I'm a biohacker, but whatever. And then people come over, they're like, what's that? What's that? What's that over there? What's this? What are you doing right there? What's that thing? How many devices do you have on your bed?
Oh, yeah. I mean, I got an 8 sleep recently, which I'm not a fan of like the Wi-Fi and all that kind of stuff, like when I'm sleeping, because I usually just I don't know the overall impact that it's going to have on my body. I'm going to be totally honest. But I do like the idea of it being unplugged and there being less of this frequency in the air. So now I have to have it plugged in. But the 8 sleep, it like brings the temperature of the bed down. Have you seen those? Mm-hmm. They're awesome. So it's like, I don't know how I slept with this before because I'm always like really hot at night and just feel like a furnace. And then it's like, yeah, this is great. I always joke with my wife that they need to make it like way colder because like I'll put it on the lowest setting and I'm still just like at neutral. It's just neutral at that point. And then what else? Zone 2 cardio. It's not. I know it's not like a biohacking tool, but that is.
Listen, it is not talked about enough.
Oh my goodness! Like I was a amateur competitive athlete. All right, so I'm not saying that I was amazing, but I was really into that space, and like I had delusions of grandeur in my early 20s that I was going to go to the Olympics and all this kind of stuff. So I was like really, really into it. And I know I was in anaerobic training, so of course they're not going to talk about Zone 2 much, but it was totally left out. And I did like CrossFit and some other stuff too. So I got around, I did like some certifications and I learned the okay amount, but I didn't understand how big of an impact that has on your health span and your longevity and how important it is for those and how good you feel when you do it. Mm-hmm. After kind of like, so I had a back fracture. And then after that, obviously the heavy weightlifting was kind of done at the load that I was, but I would kind of yo-yo with exercise regimens and, getting really intense and then kind of dialing it back, not doing so much for like a few months. And then so it was kind of always this yo-yo effect. And it's like, but I think part of that is because the intensity in my mind, like that button never shut off. Mm-hmm. So it was always like just driving myself to the point of exhaustion as much as possible. That was the metric that I used, which is really silly. But all I was doing is just exhausting my body so that by the time I would think about working out, it's like, an hour of just pure exhaustion sounds like a nightmare right now. I'm so wiped out. It's like, if I just sparse in Zone 2 cardio, I get my 3 days a week of like, my like really pushing it. And then I have my other 3 or 4 days a week of just like really light exercise.
And you're like sending the signals for sure.
Yeah. So
love it. And then the last thing I ask everybody on the show is if you could go back and talk to your 15-year-old self, what piece of advice would you give young Micah? Just about wellness, life, we to live better into the future. What's the piece of advice? You have kids, yeah?
Yeah, I do.
So, similar alignment.
Well, with a laundry list of things to avoid, but maybe we'll forget about those. I think, it's like believing in my capability of doing something. Like Ethereum, I have just finally gotten to the belief that revenue isn't the only thing, but I think what I'm trying to do with that company is make the most amount of impact possible in a positive way and actually do some good in the market. Because I see so many days company, it's just a money grab and all this kind of stuff. And I'm like actually believing like this can be a multi-billion-dollar institution that like drives good, actionable change for people. And that was actually through this conversation with my colleague Alex, and I was just kind of talking through some stuff, and he was pointing out the limiting beliefs, and he's like, "Well, why do you believe it, that way?" And so anyway, that's always kind of been this game in my head of just like these limiting beliefs that I hold, and so 15-year-old self just wasn't capable of anything in his head.
That was the story
And
you told
so-
you 15, that at 15, that was the story you told yourself, that you didn't have that as much capability as you actually damn well do, that we all can see right now.
Well, yeah, it's like, you're an idiot, you're lazy, you're not worth much. Like, those are all the things that I believed about myself. And so, yeah, I would just try to come through with like, oh, like, I don't, you know, you're not an idiot. I don't know how smart you are, but you're not an idiot. Like, you know, like, I think I would try to communicate some of that stuff to myself, because that's been like the biggest life-changing experience, accompanied by the spiritual walk that I've gone through.
Amazing. Well, I see a highly educated, intelligent man who cares so deeply about humankind and just family man and all the things I get to see by knowing you personally, and then also just seeing everything you do in the world. And I know you've been through lots of ups and downs, and just want to sort of commend you on, you know, it's like overnight success, 10 years in the making, right? This happens all the time. You've worked and worked and worked so deeply in the industry that so many of us are really appreciative for the ways that you're bringing Ozone to the world and yourself to the world and diagnostics to the world, and really just, yeah, leaning in. So thank you so much for that work.
Yeah, no, I really appreciate you, doing this interview, and made me a little bit emotional. So,
Yeah.
but yeah,
Beautiful.
thank you,
That's
Kristin.
okay. Emotion is good. Emotion is welcome here. Will you just tell people where they can check out more? I will obviously put it in the show notes and talk about it in the intro, but like where they can find all of the down and dirty details on Simply O3?
Yeah, so simplyo3.com is the best place to go to. The other website that I mentioned earlier is metaskill.com. So Simply O3 is going to have equipment, but not much for education. And then metaskill.com is going to have tons of education and no equipment. So,
And that's MEDISKILL.
yep. So that's where you can get everything you need to know about ozone therapy. And then me personally, I have an Instagram. I post really sparsely, but you can message me there if you want. And it's Micah for Health.
Amazing. Well, thank you so much for being here with us. More to come soon. And I'm excited to share all of my Simply O3 fandangos, maybe not the vaginal insufflation on social media.
Yeah, that'll be a different platform.
That's a different platform, OnlyFans or something. Yeah.
Yeah.
Yeah, but I'm excited to just continue sharing the message and sharing the love for this therapy and just, you know, you. Perfect.
Yeah. Thank you.